And we're live. Are we live? We're live. Hi, I'm Christine Espinoza. I'm with Helene's team at Remax Fine Properties. And we are doing community video series videos around our wonderful community of McDowell Mountain Ranch to let our neighbors know what's going on in the neighborhood. And if you live in McDowell Mountain, you've probably driven by this place many of times. It's in the shopping center where the Twisted Lizard is, off of 105th Street and McDowell Mountain Ranch Road. I was driving by and saw this sign that said Stem Spa, and I was thinking, what the heck is that? I keep hearing about stem cells and hearing about people talk about getting better and all these things about stem cells, but I don't really know the ins and outs of it. So we're pretty lucky here that we have this office that just opened up called the Stem Spa that specializes in just that. So stay with me. I'm going to interview a couple of the doctors here. Also give you a tour of the office. And then our other team member, Scott Reed, is going to get an actual IV bag of fluids live so we can show you what it's all about. So come over with me and I'm going to interview Dr. Haggard. It's a pretty office too. Dr. Haggard, thank you for having us today.
Thanks for visiting us.
So this is Dr. Haggard. He is a naturopathic physician here at the Stem Spa, and he's a wealth of knowledge when it comes to stem cells. So stem cells, what is the hype? Tell me a little bit about well, let's start with what got you interested in the whole stem cell therapy.
We had a bunch of family members that kept asking us questions about it. I had some friends and their family, and they said, why can't we do this here? We have all these people, they're going out of the country, they're getting the stem cells. Why can't we do it here? What's really the issue? And when I started to look into it, I realized that there's not laws against using the therapy. It was simply that the government made it illegal to use tax dollars to fund stem cell research. But it doesn't stop us from using it with patients. So once we got started, then we were targeting different conditions. We first started looking at conditions where people came in and they had no joint space, or they had something specific, some tissue that was damaged, degenerated, and we thought that stem cells would really help those conditions and regenerate. But then when we did these treatments, we kept seeing over and over unexpected results. So we would inject somebody with stem cells, either with IV or an injection, and then they would say, oh, by the way, my eyesight got better, or by the way, my other joint pain got better, or other inflammation stuff got better. And so as we started to really look at that, then at the same time we kept having people say, well, what's our stem cells good for maybe this condition or this condition? And I just didn't know at the time. But then as we got into more and more research, realized there's a wealth of research out there on all these different conditions that are inflammatory based, like autism, multiple sclerosis, type 1 diabetes, rheumatoid arthritis. The list just goes on and on.
That's amazing. So kids are coming in with autism and getting the stem cell therapies?
Yes.
I didn't know that. Well, so what is a stem cell? Where does it come from? What the heck is it? Where do you get it?
So stem cells are available in multiple tissues, but the younger the stem cell, the better. So that's where we try to really get the stem cells from the placenta, cord blood, or amniotic membranes of the newborns. And so one of the other common questions is, are babies dying for this therapy when we get these therapies? Not at all, right? There's no ethical issues there. We're not doing anything with fetal stem cells. So this is all just typically prior to the last 10 years, this has all been just medical waste.
Yeah, well, I know, because when I have two boys and I had them 9 and 12 years ago, and I saved the cord blood. But I thought that was just for the purpose of if they end up getting sick later in life, they can use their own stem cells. I didn't realize that you can take other people's stem cells and put them into your body. So does it matter where they come from, the stem cells?
It does. It depends on what condition you're treating, but they just had a new study that came out last month at the University of Illinois, and they actually cured a dozen people of sickle cell anemia with stem cells that didn't quite match. So they were half matched, because before they've done it with people that have siblings that have an exact match for their stem cells.
Right, right. So when you come in here and you get stem cell therapy, whose stem cells are you getting? I mean, how do you know that they're good ones?
Yeah, so they go through a stringent process to actually collect and make sure that these are the right stem cells that are going to be safe. So these are all processed in FDA registered facilities, and the mothers go through an intense screening process. They're not allowed to have tattoos. They can't have any diseases.
Oh, so they apply for this before they donate it? Is that
Correct.
kind of how it works?
There's a large process that they go through. And then from there, those stem cells, after the mothers are screened, of those, then the stem cells themselves and the tissues are tested for any viral diseases or any other infectious diseases.
Wow.
And then you process them. So of those women that donate, their tissues, the birth tissues, only 1 in 10 on average is accepted into the program.
Wow, okay, so you feel confident that when people are getting this stem cell therapy, they're getting the good stuff that's been tested and it's
Absolutely.
pure and good for you. Okay, so tell me, you were saying before, I found this so interesting, that people would come in and for one thing, like rheumatoid arthritis, did I say that right? Rheumatoid arthritis, and then they would notice that their eyesight was getting better, or their other things were getting better that they weren't even expecting. Tell us about that.
Yeah, so the list just keeps going on and on that people come in and say, oh, by the way, this got better. We've heard everything from cognitive function, energy, eyesight, blood sugars for people that are diabetic have improved, and I can't say enough about it.
Don't you just want to shout from the rooftops, look everyone, look what we've figured out and how well it's working. It's like, why doesn't everyone, well, I guess everyone doesn't do it because it is pricey, right? And it's not covered by insurance.
It is pricey and it's not covered by insurance, but at the same time, when you look at that and put it in really a comparison of what is pricey, an average multiple sclerosis patient will have about $4 million in healthcare cost over their once they're diagnosed. And those medications are very expensive. And you compare that with maybe 1 or 2 stem cell treatments, and they did a recent meta-analysis of the published data on the people who had multiple sclerosis and they had stem cell therapies, and they found that at the 2-year mark, 83% of those patients had no evidence of disease activity.
Wow. So 2 years after what?
One treatment.
One treatment?
Or 2, depending on the study.
That's amazing.
So that sounds pretty cost effective to me for that population.
Right, right. So what would you say the majority of people who come in here are coming in here for? Like, what are they getting treated for?
Mainly pain. This is where stem cells just shine. They reduce inflammation, they modulate the immune system, and they do regenerate certain things. But what really surprised me is how much the inflammatory component really is in these diseases, and it's actually helped us to have a different target when we now treat these conditions like autism. We don't just focus on the social support or the how they're being taught, the teaching, and those kind of interventions. We look at these now as these kids have a large inflammatory component, and we can treat that on multiple levels. So it's gotten us to have a little bit more guidance and target for things like probiotics, prebiotics, methylation factors. These are all things that's what they showed the stem cells did. So we can also use supplements and make a very comprehensive treatment program to even enhance the effect of the stem cells.
Okay, so people don't just come here for the treatment. You kind of take a holistic approach.
Absolutely.
Where
we're going to talk about diet, we're going to talk about exercise, detoxification, whatever needs to be done in order to maximize that. Because if you're going to come in and do stem cell treatment and then you're going to go eat fast food, it's probably not going to work as good.
Right. Shoot.
So.
They haven't found that yet. They haven't found that magic injection yet where you can do everything wrong and be perfectly healthy, but I didn't think that would happen anyway. Okay, so anything else that you want to say that maybe people don't know about stem cells, or anything else you want to get out about stem spa?
The biggest thing is if you have a chronic condition and you're not sure if stem cells can help, I would say look into it, because maybe not today, we might not have the data, but every day more and more data is coming out. Like I didn't know you could cure sickle cell anemia until last month.
Wow. Wow. And is it a free consultation if people want to come here and talk to you, or is there a charge for that?
Yeah, absolutely. We can talk with people and just kind of see if they're in the right space, or what we know about it. We can share that information to see if that's something you want to move forward with.
So look, if you're curious and you want to know, or you have pain, or have a family member who has pain, you can come here and talk to the doctors for free and get more information. And they're having grand opening here. It's see, I wrote down
Saturday, May 19th.
Saturday, May 19th from 12 to 5. Is that a drop-in? Are you going to be speaking? What's happening?
We have lots of activities planned for that, but we'll have me, Dr. Andrea, and a couple of our nurses here to answer questions for anybody who wants to look into it more, or just get more information. Also, we're going to be doing vitamin IVs that day to kind of help promote and help people understand what vitamin IVs are good for.
Which are awesome. I do those, and Scott's about to do it in a second. Love those. And I would drive a long way to get those done. And these places are popping up all the time now. You see the drip room and all these places that are giving bags of IV fluids. Yours are different. I know Dr. Andrea is going to talk to us about that in a minute. But it's awesome to know that if you wake up on a Friday morning, you've got a lot of stuff going on this weekend, you can just walk in here and get a bag of IV fluids. If you start to feel a cold coming on, you just get the IV bag of fluids. And for me, it has knocked it out.
Yeah,
so many times. It's amazing.
If you have a cold or a sickness and you just didn't quite get over it all the way, that's where they really shine. So
awesome. So come by on their grand opening and you can check out. And you're going to be offering specials too.
Yes.
Right?
We have IV specials. We have B12 injection specials and food.
Oh, I like those B12s too.
So
good. Well, thank you so much for letting us stop by. And now we're going to check out the rest of the place and meet Dr. Andrea and watch Scott get poked in the arm. Okay, thank you, Dr. Haggart.
Thank you.
Okay, come on over. Gotta have my green tea with me, as usual. Hey.
Hey.
Here we are. So we have good old Scott Reed. Scott is on Helene's team, one of the realtors with me. It's so hard being a realtor, so you gotta get some extra energy. So he's over here, and he's gonna be our demonstration of the one who's gonna get the IV bag of fluids. Actually, let me get on this side.
All right.
So Jillian is gonna help us out.
Hi,
Hi, Jillian.
It's Nurses Week.
Yes.
Yes, this is Nurses
Thank you.
Week. Thank you for everything that you do.
Yes.
So do you want to tell us what you're doing to prep him for the IV?
All right. So Scott, I came back here. We checked his vital signs, making sure everything is safe.
I'm alive.
Yes. And pretty healthy. Doesn't have any major medical histories, heart disease or kidney, which would be a contraindication to getting, an IV fluid here. So we're all in the clear for that. Feels comfortable, doesn't have any allergies, and this is his first IV infusion. So he is going to get a really great dose of vitamins, way more so than you could get from just eating all the healthy foods you could all day. It's going to go straight to his tissues. He's going to feel a lot better after this. Nice little extra dose of vitamin B. And
Perfect.
I've explained, so what I'm going to do, I'm going to go back under our laminar flow hood, sterilely prepare his IV bag. And then once that's ready, takes me about 5 minutes to get that together. Come on out here, we're gonna start an IV. And then within about 20 minutes, he'll be ready to go.
I'll be a new man.
Yes.
Yay!
Ready to go,
That's
sell some real
exciting.
estate.
Yes.
Sweet. Okay, so
Alright.
we'll let you go over there,
Okay.
and I'll talk to Dr. Andrea, and then we'll go check out what you're doing.
Okay.
Okay, so I'm gonna come over here. Okay, can you see us good? Okay, this is Dr.
Hello.
Andrea, everybody.
Hi, everyone.
She is another one of the naturopaths here at STEM Spa. Andrea, give us a little bit of history about you and your medical practice.
So I've been in practice since 2010. I'm a native from Arizona, so I was born and raised here, and it's been about 2 years since I've returned. I was in Carlsbad, California, practicing there, which was lovely, but family always brings you back, so here I am again. And I love to focus in regenerative medicine, so I really feel so much passion to see patients get out of pain. I myself am a patient of the services that I provide, so I know firsthand what it's like to receive those services and what it's like to be free of pain. And so as a very active mom of 3 babies, my oldest being 4, my youngest being 9 months, it's
Oh my goodness.
very
you're busy.
important to not have my low back pain.
Right.
So, yeah.
Well, tell us what's different. I mean, there's pain management clinics, I feel like, on every corner.
Mm-hmm.
What's different between that and coming here and getting stem cell therapy?
It's a great question. So I happen to work in the conventional model, which there's a time and a place, and I really believe in conventional care for the time and the place that it's right. You know, if I get injured or I get in a car accident, I want you to take me to the hospital, and that's the kind of care I want to receive. For some minor acute injuries or chronic injuries with musculoskeletal conditions, whether it be tears or tendonitis, you love playing golf or tennis and you've got issues there, you've got runner's knees, or you have problems doing yoga. I mean, there's so many activities that we all love to enjoy, and so really providing treatments that help to reduce the inflammation and give lasting benefits is the ultimate goal. In the conventional model, when I work in that model, it's an internal medicine family practice, and there's also an urgent care that I participate in for some shifts. And it's very conventional, so it's very much patient comes in, they have pain. The options that are available to me as a provider are anti-inflammatories to varying degrees, from
Pills, right? Or
of course,
shots?
pills and shots.
Okay.
Pills and shots. So from ibuprofen all the way up to Vicodins and that nature of drug control.
Which is scary.
Pain
I mean,
control.
if you can avoid going down that road, it's
It
best.
is, yeah, and it's a big problem, as we all know. And so, the problem also with it is the injections that are options are either pain injections, the same medication, in other words, that you would take orally, like a
cortisol or a steroid or something?
Toradol would be an example, like an ibuprofen anti-inflammatory
Okay.
medication that would also be given as a shot to control pain, or an injection known as a corticosteroid injection. So although that might get patients out of pain right away, and sometimes might be necessary in certain situations, the long-term repercussions of that are not the greatest.
So it's more like a temporary like a
fix.
Band-Aid.
Yes, exactly. And so what my goal is to provide a treatment that allows for healing of the tissues. Really in naturopathic medicine, we believe in treating the cause of a condition and identifying and evaluating the root cause.
Mm-hmm.
So if we can address that and allow the tissues to heal, then the pain goes away. Patients don't have to rely on painkillers. They don't have to rely on corticosteroids, which, like I said, over the long term can weaken the tissues and damage them further. So there's a pretty significant difference, and again, there's a time and a place, but
And you felt it too. What were you experiencing, and what did you notice
yeah.
afterwards?
So I don't know when I did this. I don't know how I did this. Honestly, it could have been exacerbated from my pregnancies, but I have some slippage of my lumbar disc. So one of them sits just anterior to the other. And although mine is mild, it's the lowest grade that you can have, it actually produces a good amount of pain.
Oh, sure.
I mean, if I'm working with patients all day and I'm kind of bent over, my low back at the end of the day will really ache. So thankfully, I've got the knowledge that I have, and I've got the community and the network to know how to fix it. So, of course, I received prolotherapy treatments. And I had after my first treatment, I had a significant improvement. I chose to receive as many treatments as I could before my third pregnancy because I knew that in my situation, my hormones were going to change and my ligaments were going to get lax again.
Can you not get these treatments when you're pregnant?
Well, not necessarily. I would say I actually happened to find out that I was pregnant during my first, when I had received the treatment during my first trimester, but the solutions that are injected are not harmful. I would say that being a mom and having that experience, I wouldn't want somebody knowingly going in pregnant because it is an injection therapy, and that can produce some
Sure.
anxiety, and so we don't want to stress the body anymore.
So
during
you
pregnancy.
did a few therapies before you got pregnant again, and then you noticed what?
Pain reduction. So everything from when I need to bend over and pick up my kids, when I need to put on their shoes. I mean, even little activities like that over the whole course of a day, repetitive, my low back would hurt. But after receiving the treatments, I felt stronger. My back felt more stable. It didn't feel tender or painful at the end of the day. I didn't have to, towards the end of my pregnancy, it was like I would have to sit in a chair to do dishes, for example, because my back would just hurt,
Yeah.
and my belly, and everything.
Well, and even regardless of being pregnant, I feel like just getting older.
Yeah.
I mean, I will turn my head really quick, and then my neck will hurt the rest of the day. It's like, what the heck is going on?
Yeah, I know that.
So, but it's interesting though that this therapy is not just it's for all ages, right? So
Absolutely.
anyone who has pain can come in
Absolutely.
and get this treatment. Well, let's talk for a minute about the IV treatment, because I know that Jillian is mixing up the IV treatment for Scott. Why? Let's look at what she's doing, and then you can tell us
Sure.
why she's doing this, because I've never had it mixed up like this before.
Sure. So it looks like she's coming out right now.
Oh, she's coming out. Well, let's look in here real quick to show us the room.
Do you want to come all the way in?
Yeah, just
Okay. It's kind of loud.
okay.
It's kind of loud in here.
This looks very sterile,
Yes.
very like clean.
So this is a laminar flow hood, and this is very important for properly mixing up IV solutions.
I wonder if you can hear. Okay.
Can you hear me okay? So I can speak a little louder, but whenever you're having a mixture of 3 or more ingredients in a bag, you're required by law to have a hood present to clean the air and reduce the risk of any kind of infection or bacteria. Right? So
Okay.
the bag is included as one of those 3 ingredients. So really, in order to do IV bags with the utmost standard in safety and sterility and cleanliness, this is what you need.
So
And
look at this place. Super clean. Like everything.
Everything is done in a way that is to the highest degree of standard, and that's what we stand for here.
That's great. Let's come out here and let's watch Scott get injected. Woo! Are you ready?
I'm ready.
Oh, are you reading the newsletter stuff?
I am. I'm
Oh.
getting caught up on all the community news.
Nice. Okay, so
Okay, so I just made his
So
IV
here.
formula, and this is our vitamin IV. We also offer a hydration IV. Okay.
are you scared?
I think I'm okay. I just gave blood at the Remax blood drive, so
Oh,
wonderful. Nice.
yeah.
Well, now you're getting something. You're not
Right,
just
I'm giving it back.
Yes.
Yeah.
Rehydrating, because it is getting hot. So we'll probably be pretty busy with those hydration IVs. I
Yes.
would think.
The heat has really kicked in.
Okay, so
And
you
it's-
have vitamin IVs and then you have hydration IVs. I didn't know what that is.
So they're all going to be hydrating to some degree, right? But the hydration IV, this is the nutritional IV. The hydration IV is going to provide a little bit more oomph in that regard.
Okay.
But this
Come in so
bag,
we can hear. I'm afraid we will.
this bag in particular is a mixture of all of our B vitamins. We've got some calcium, magnesium, some vitamin C, selenium. So it's a really good comprehensive bag that provides great amounts of energy improvements. And again, when we're giving an IV, we're able to access the tissues immediately. So it's bioavailable, made immediately available to the tissues and the cells. So when we take supplements orally, which I do support, there is a benefit to doing IVs because we bypass any issues with absorption. A lot of patients nowadays have issues with IBS, with Crohn's, ulcerative colitis, a variety of different gastrointestinal disorders. So the absorption of an oral vitamin is not going to be as effective as an IV. It just goes right into the bloodstream. So we can also give higher doses because of that without irritation to the tissues. So for example, everybody knows about vitamin C and the use of that for supporting the immune system as an antioxidant. Well, one of the side effects of vitamin C in higher doses orally is a loose stool. So if you take too much of it, you're gonna get loose stool and you're not gonna be able to max out at the benefits that would really provide immune support when you're sick. If you come in and you get something like this, we can achieve a very high dose and make a big impact on the immune system without that kind of an irritation. So
So,
there are a lot of-
question for you. What about for athletes? If athletes have a big meet coming up or game, or they have a big tournament, is there something that they come in and a treatment that they get?
Yeah, so everything's individualized, and there are a variety of approaches that I take for athletes, and IV bags would certainly be part of that. We have a variety of services here. We also have ozone treatments, and so there would be a great benefit to do something like that before or after for recovery or preparation. Generally, when patients are athletes and they're training for something, they're really depleting themselves.
Right.
And unless they're properly supporting during that process with a variety of things, with oral supplementation, there's some deficiency present. So they can go into it stronger.
Yeah, well, here in Arizona, I mean, it's just so hot. And if you're hiking or kids playing sports, adults, whatever, I mean, just you sweat out so much.
Yeah.
So what I thought was cool, you guys said you can walk in to get the IV treatment. You don't even have to have an appointment. So that's great. If you're feeling kind of sluggish, or you got a big weekend ahead of you, you can just walk right in the door.
Or if you're going to be traveling, that's another one that I always like to
Oh,
include.
yes.
The
You're
air
going to be on an
quality.
airplane.
Yeah, and the plane is so poor. A lot of people often get sick, and the stress of travel and the busyness of all of that. So a nice way to ramp up the immune system and support yourself while you're getting ready for a trip.
So Jillian said that Scott has really nice veins. So hopefully she'll be able to just get it on first try.
The nice thing is we use nice small needles for those of you that might be a little bit scared. So,
Do you want the stool, or are you good to stand?
yeah, no, that'd be great. Thanks.
It's right underneath your knees.
Okay, thanks. Perfect. Thank you.
Are you ready?
Ready?
I don't look at the needle when it goes in.
No.
That's okay.
Myself.
You don't have to. I'm the only one that has to look. Okay. Wow, pressure's on now, huh?
Don't do this at home.
That first try.
There we go.
Did it hurt? How did it feel?
Didn't even feel it.
Really?
No.
Nice.
It is a small needle.
Yeah.
Yep.
You said they use the.
These are actually the same size that we use on the little babies. So,
There you go.
So how long does this take for that whole bag of fluid typically to...
this should only take about 20 minutes to go in.
Okay.
So we definitely got a great nice vein here. And then I'm going to go ahead and start running it, and you just tell me how it feels. You might feel, you might even be able to actually taste it, those vitamin Bs, and that actually will be really quick in there. Okay?
Okay.
Okay, so how's it feeling?
Don't feel anything.
Excellent. That's good. Tasting anything?
A little bit, yeah.
Okay.
What does it taste like?
Might be a little bit bitter.
It's very faint. I don't know what it tastes like. Just
Vitamins.
vitamins.
Yeah.
Yeah. It tastes like vitamin smell,
Yeah.
but not in
Yeah.
a really bad way or strong way. Yeah.
You are a healthy, healthy guy. Lots of good blood already. And hydration.
Okay, so while they're... You let us know if you're okay.
Okay.
If you
I mean,
need
if
to
I'm not,
recline,
if I'm not
I know,
okay.
let us know if you're not okay. If you need to recline,
right.
they got comfy chairs.
Very comfy
So
chairs.
we're good. You got your drink, your newsletter.
That's
I'm
right.
good.
So let's why don't we come over here real
You want to see one of the
yeah.
treatment rooms?
let's go in one of the treatment rooms.
over here. We have one room that's in use here, but we can show you in this space here.
So this is one of the treatment rooms where they do, is this where they do the stem cell
Yes. So,
therapy? Okay.
So this room has multiple functions. We do have the esthetician that comes in here doing the vampire facials, and we do the joint injection treatments in this room as well.
Okay, vampire facial. I want to talk about the vampire facial.
Yes.
Called the PRP.
Yeah. So it's
PRP.
Mhm.
What does that stand for?
Platelet-rich plasma.
Platelet-rich plasma. So this is like the thing that I'm hearing everyone talk about. I'm reading it in magazines. I have friends that have done it. I totally want to do it. I'm coming back. I'm not doing it on Facebook Live for sure. But explain to everyone what you do. It's not your regular facial.
Right.
They use blood, which is why they call it the vampire facial. So can you explain that?
Right. So we have an esthetician who comes in to provide those services. But what's entailed is first drawing the patient's blood. And so this is the same procedure that I use when I do platelet-rich plasma joint injections. So we take your blood and we spin it down in a special centrifuge. We have another very fancy special hood in another room that we operate all of these biologic materials, the stem cells, the platelet-rich plasma. Everything is done separate from that, which is another, again, utmost of quality and standard. So we draw the blood, we spin it down in that special centrifuge, and what we get and what we're after are the concentration of those platelets. So again, the platelet-rich plasma. So the reason why that's important is because that's where we have a significant concentration of growth factors. And growth factors we know are very important in, I'm going to talk about the combination facials, but also joints. So for soft tissue, for bone healing. For the facials, what we see is an improvement in collagen production. So what that means for you as a patient are less fine lines and wrinkles. Also, one of the really phenomenal cases that you'd want to use a vampire facial for, acne scars. Acne scars, and you can see this in the literature, before and after PRP facials are significant reductions in acne scars. So really, we want
how many would you have to do? How many to see a result? Do you normally get a package?
So ideally what I see is about 4 treatments.
Okay.
But I can see benefits starting around the 2-month mark.
Mm-hmm.
And the treatments are separated every 2 to 3 weeks.
Okay.
And so there's so much variability and depends on the severity of the individual
Sure.
situation.
But so they take the blood and then they separate it, and then tell us what you do to the face.
So then the esthetician uses a microneedle, and the solution that we just discussed, that platelet-rich plasma, is then microneedled into the skin. And so it's about, I would say, a 45-minute treatment.
Mm-hmm.
And I don't know all of what she includes as her individual treatment, whether, it's like a upper body massage or not, because I don't know what she's doing in here exactly when she's doing her method.
Uh-huh.
But that's what we're using.
So after that, how many days? I mean, do you look all red when you leave? And how can you wear makeup after? Like, how what's the after effect or downtime?
Sure. So there are 2 kits. So when we do platelet-rich plasma, when I'm doing joint injections, I'm using one that looks red, and when we're doing the PRP facials, we're using a pure solution. So you don't have that really red. It's not like you come out looking like a vampire with blood on your face or anything like that. I mean, there is going to be some heightened redness of the skin surface, but the solution is a mostly clear solution that's used. And so, we would like you to avoid makeup for that first 24 or 48 hours. Every recommendation can be a little bit different based on the individual.
Okay, but you're not going to have a week of a bright red face and
generally no.
Do you have swelling or scabbing or anything like that?
No. So I don't see any scabbing. I wouldn't really say swelling either. There's just a mild amount of inflammation, so a little bit of redness, but nothing that's real noticeable, like significantly.
Okay.
Where you'd say, "Whoa, what did you just go do?" So,
Well, I think I'll try it. It's worth a try.
Yes.
I'm doing it.
Yes.
I've been thinking about it for a long time, and now that you're right here in the neighborhood, gotta support the locals.
That's right.
Well, let's go check back and see how Scott's doing with this IV.
Sure.
Hey.
Hey.
He's still alive. And he's happy.
I'm happy.
Doing great.
Does it burn at all? How does it feel?
No,
Feels good?
Don't feel it at all.
Nice. Well, we'll have to check back in with Scott in a few days or next week and see if he felt the burst of energy. Is there anything else, Dr. Andrea, that Can you see us okay? Are we like all on the same? Okay, is there anything else that you wanted to share about just stem cell therapy or the stem spa?
Yeah, so if you want to get out of pain, that's really what we're here for, you know? So I treat the patients. I'm the practicing physician here, and what you can expect to receive is the utmost of standards and quality and care, and whether it's stem cells or PRP, we can treat a variety of joints, from everything as small as a toe, which I just treated last week, to a finger, to your larger body parts. Shoulders and knees are very common, hips as well, and we'll individualize it to your needs. So if you're interested and you're not sure what might be best suited for you, come on in. We can talk about that, discuss platelet-rich plasma or stem cells, figure out what's the best course of action, and put together a package to help support you once you leave to improve the effects of the treatments with supplementation. So our website is stemspa.com. I don't know our number off the top of my head by heart.
I have
I
it.
have too much to remember.
It's 480-935-2838. And don't forget, if you want to know more, stop by during the grand opening. That's going to be Saturday, May 19th from 12 to 5. You can meet Dr. Andrea, you can meet Dr. Haggart, you can check out the place. They're going to offer specials that you can buy that day.
We'll have a raffle.
A raffle, sweet. Are you giving away a free vampire facial?
Actually, I don't know what we've decided on yet. Might be a good one to consider, though.
I think you
will
should.
bring that up.
And I'll be here.
Yes.
So yeah, thank you
Thank
so
you.
much for having us. It's such a fascinating thing, and really awesome to know that we have this right in our neighborhood. And I know that they just opened, but people are already traveling from other parts of the state to be here and take advantage of what they have, which is pretty awesome. So thanks again for tuning in live with us on our community series video. Again, I'm Christine Espinoza with Helene's team. This is Scott Reed with Helene's team. If you have any questions regarding real estate, we would love to help you. Our number is 480-563-3333, and you can follow us on Facebook at McDowell Mountain Ranch Homes, Instagram, go on our website, all of that. Thanks everybody for tuning in. Have a great day.